Hello, I'm Cecilia Simmons, the Financial Services Manager here at St. Clair County Health Department, and I will be narrating this presentation today. We're going to be discussing grant processes, budgets, expenses, and revenues. I would like to remind everyone what our mission and vision here at the Health Department is. Our mission is that St. Clair County Health Department is the trusted public health expert in our community and our environment. Our vision is a healthy community, healthy environment. We have multiple sources that we receive funding from that supports our services we provide here at the Health Department. As you can see, funding is received from the county. We have over 40 federal and state grants. Some of these individual grants have several levels within them, like our Children's Special Health Care Services. It's listed as only one grant. However, there are 3 different grants within the individual grant. Patient pay for services they receive at our facilities, insurance fees for services that are provided by our staff, then billed to a third-party payer, such as Medicaid, Medicaid qualified health plans, Blue Cross Blue Shield of Michigan, and many other commercial health plans. And our finally licenses and permits, which is specific to environmental health, such as well and septic permits and restaurant licenses. From our list on the prior screen, this is a breakout as to what percentages that each of these revenue streams are used to calculate our annual budgets. Federal and state grants contribute about 48% of funds, and only 19% of the county appropriation is used to help fund some of our programs. We do have significant amounts that is collected through fees and services, licenses, and permits. The list of expenditures is not all-inclusive, but covers the majority of the programs within the health department. The all other programs listed would include the off-site clinics, with the exception of teen health, but it also has several of our smaller grants. Again, this is just a breakout of the programs showing the percentage of expenses. Nursing has a combination of several programs, causing the percentage to be significantly larger than others. Considering our expenses and reporting of grants, our time tracking is an essential tool in this process. It allows us to report accurately cost associations with wages and fringes to each of the grants. Know your org keys. Many of you have heard, watch how you're recording your time and use the correct org key. This slide is a list of the many different accounts that are associated with our grants and other funding sources. You need to record your time according to what project or program you're working in. An example of the usage of these keys is the 950530, which is specific to our hearing program, and 950531, which is specific to vision. There's many listed here, so we need to make sure you're understanding which key to use. If you enter your time in the wrong program, it causes inaccurate reporting to our grants. If you've made an error in your time tracking, please make sure to inform your supervisor so they can let us know. It becomes very time-consuming to move the wages and fringes from one program to another, but it can be done. Of course, we prefer to always get it right the first time. Moving on into the actual grant management. In the previous slides, we covered what types of revenue we receive. The majority of the federal and state grants require specific reporting as compared to some of our smaller grants. The state of Michigan has their own reporting program called eGrams. The state has a different reporting period, with the first quarter starting on October 1st and ending September 30th, compared to the county that runs on a calendar year, January 1st through December 31st. This causes some issues when years cross over. Our state budgets are due in May for the next fiscal year, so this May of 2025, we will be submitting our 2026 budgets. We're required to submit a financial status report to the state of Michigan on a quarterly basis. Financial status reports, commonly called FSR, is our way of informing the state the progress of our grants. This is an example of what the reporting document looks like. The first page is where we list all of our expenses. Some of these main categories you'll see, we report salary and wages, fringe benefits, supplies and materials, and travel cost. Information entered in the FSR is pulled from our county's accounting software called Central Square. The report that is uploaded is pulled from time tracking. Remember the slide about Know Your Org Key? This is where it becomes extremely important. Each program's general ledger account is pulled by the corresponding org key. The wages and fringe totals are what is entered quarterly in the FSR report. All the other expenses are entered when purchases are put into smart sheets, submitted conference requests, and submitted invoices sent downtown. In 2024, Kathy submitted 48 conference requests, 946 purchase requests, and over 1,468 invoices were submitted. The next document that we enter data on in eGrams is the revenue portion. The source of our funding is also pulled from our account program. The revenue received from the state is entered in each of the grants. All third-party payments are posted by our billing department to patient accounts and are then recorded in the accounting program to each specific org key where the place of service was recorded. This is why it's critical to enter the correct site location accurately so the revenue is recorded in the correct program location. This is an example of the revenue slide in our FSR record for the state. This is where we report grant funds, insurance billings, fees, and any local funds that are required. Thanks to our billing department, Lisa, our billing and support coordinator, Debbie, and Linda, we've received $1,493,335 in insurance revenue. They've processed 14,622 claims, and of which 896 of those claims were specific to mental health services. And thank you to all the clerks who have collected $18,665 in patient payments in 2024. Over the past 3 years, we have seen a consistent increase in our fund balance, which has resulted in a surplus. In the fall of 2024, there was a transfer of $3,913,364 of that surplus to the county general fund, further supporting the broader needs of our county. We've been working closely with directors to improve financial awareness across the organization. Jeff and myself are working on providing better tools and reporting systems to help leadership manage their budgets more effectively and ensuring that we can continue offering quality services to our residents. This is a historical record of our budgets over the last 5 years. You can see we have held pretty steady considering the cost of living increases. Overall, we have only seen an increase in our budget by 11%. We're proud of the progress we've made in ensuring financial stability, supporting our teams, and serving our community more effectively. If you have any questions, please reach out to any of us for more information. Jeff and I hope that this information has helped you understand some of the financial process we do here at the Health Department, and we are always here to answer your questions or assist in your program financial needs. Thank you for your time.